As coronavirus continues to spread in China and in some places across the world, people who've been to the areas afflicted are being asked to go to the doctor to make sure that they have not spread the disease. Now, one man did exactly just that and ended up getting hit with an insane medical bill. So now this is Osmel Martinez Oscu, and he had taken a work trip to China. And when he returned to Miami, that's where he lives, he started developing flu-like symptoms. So now he was thinking, did I get coronavirus? I mean, what's going on here? I better go to the doctor, right? He then went to Jackson Memorial Hospital, got himself tested, and turns out it was just a normal flu, right? I guess it's that time of year. I don't ever get the flu, so it's one of those things. No, I don't get the flu shot. Yes, I probably should. But no, I never get the flu. And if it happens, I probably sleep for a day and then throw up once. If I'm very unlucky, I'll throw up once. So I'm very flu resistant. This guy, flu-like symptoms, went to China. Oh crap. I got to get tested. I got to get checked out. And thankfully he was fine. Now the problem is he got hit with a $3,000 bill from his insurance company for just getting himself checked out. Okay, so let me give you the details here. So now, to go a little bit meta on what created this situation in the first place, in 2018, Trump, his administration rolled back the regulations in the ACA and allowed for junk insurance plans to be in the market. Now, consumers, according to the Herald's Ben Connerk, mistakenly assumed the plans with lower monthly costs will be better than no insurance at all in the case of medical catastrophe. But often the plans aren't very different from going without insurance altogether. Now, Oscu's insurance okay, so this is where they get you with the fine print, right? So you've got lower monthly costs, but when something happens, you get insane stipulations on whether or not it will actually cover any of those costs. Now, his insurance plan stipulated that he's only responsible for $1,400 of the bill, as long as he could find and present up to 3 years of medical records to prove that the flu that he had contracted wasn't brought on by a pre-existing condition. So you have a $1,400 deductible, right? And you have to give them literally your medical records. 3 years of medical records to make sure you don't have a pre-existing condition. That is ridiculous. Insane. Nowhere in the developed world does insurance work like this. And so that brings me to the problem of American insurance, right? If something like coronavirus, like, a huge outbreak of something happens here, we're pretty much screwed. It's not because we don't have the medical technology and the planning to be able, and the hospitals to be able to, take care of this, right? No, it's because so many people don't have insurance, they're not going to go to a doctor. They're not going to go to a hospital because they can't afford it. It's insane. It's insane. This promotes the spread of deadly disease. Again, Sabrina Corlett talked to the Herald, right? And said, when somebody has flu-like symptoms, you want them to seek medical care. If they have one of these junk plans, they know they might be on the hook for more than they can afford to seek that care. A lot of them just won't. And that is a public health concern. Yes, it is. Yes, it is. Now, look, I don't have insurance, right? So again, it's super unaffordable. Can't do it. So the rule is don't go to the doctor unless you're dying, essentially. If you're not dying, can't do it. Don't go to the doctor. Horrible rule, I know. But since you don't have any other option, what are you supposed to do? You can't afford it. Now, I'm fortunate to be pretty healthy. Again, I told you that I really don't ever get the flu, but you can't count on that forever. I can't count on that forever. At some point, insurance costs have to come down to a point of which someone like me can afford it. And I'm sure someone like you can afford it. But what's dangerous about this is, again, that people who either can't afford insurance or like this guy are super underinsured with a junk plan, and they decide not to go to the doctor because maybe they see this story and think, well, hell, I can't afford $3,000. It's probably just the normal flu. Well, what if it turns out the other way and they end up, spreading it to other people? I mean, it's a disaster. It's a disaster. In fact, Askew says, he's got a quote, how can they expect normal citizens to contribute to eliminating the potential risk of person-to-person spread if hospitals are waiting to charge us $3,270 for a simple blood test and a nasal swab? And that really is the kicker right there, right? It's not as if they were doing any sort of invasive procedure or test. All that they were trying to do, again, blood test, swab. Something that should be very cheap, not cheap at all, super expensive. And that's the problem, right? And so, look, not having Medicare for all, this is a great example of why not having it is a danger to our country. Look, already 60,000 people a year die because they don't have health care, because they are either uninsured or underinsured, and they can't go to a doctor. This is the problem. This is the problem. And it's so much worse than it has to be, because what we can do Medicare for everybody, and we can do it cheaper than what we have in our system right now, and there's just no political will to do it, at least among the establishment. We need Medicare for all, and we need it now, because if we don't, we are continuing to not only condemn 68,000 people a year, but also if something like a big outbreak happens, well, we're condemning a lot more people. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent, progressive media.